Think that burning in your stomach is just a mild ache? Don't ignore it, it could be a deadly ulcer. These aren't just minor irritations, they're open wounds in your digestive tract that, if neglected, can lead to bleeding, infection, or even life-threatening perforation. These aren't mere irritations, they're open wounds in your digestive tract, capable of causing internal bleeding, infection, and even life-threatening perforation if ignored. In the next 8 minutes, learn what causes ulcers, how to spot them early, get diagnosed, treated, and why delaying could cost you your life. An ulcer is an open sore that forms on the inner lining of your stomach or the beginning of your small intestine. Many people ignore the warning signs, but the most common symptom is a burning or gnawing pain in the upper belly, especially between meals or at night. The two main causes are a bacterial infection called Helicobacter pylori and long-term use of pain relievers like ibuprofen or aspirin. If left untreated, ulcers can lead to serious issues such as bleeding, infections, or even holes in the digestive lining. How do ulcers start? Imagine your stomach as a strong fortress protected by a thick mucus wall. But sometimes, the corrosive acid that helps digest food starts wearing away that protective layer. Without mucus to shield it, the acid slowly eats into the soft inner lining, forming a painful sore. This erosion creates what we call an ulcer. A sneaky culprit behind ulcers is a tiny bacterium named Helicobacter pylori, or H. pylori. This germ lives quietly in the mucus lining and goes unnoticed in many people. But over months or years, it damages the protective coat and causes inflammation. When that happens, stomach acid starts attacking the exposed tissue. That's when ulcers form. Signs and symptoms of ulcers. Early signs are easily dismissed. Mild burning or gnawing pain in the upper abdomen, especially between meals or at night. Duodenal ulcers. Pain a few hours after eating, relieved by food. Gastric ulcers. Pain worsens with food. Other clues: bloating, burping, poor appetite, unintended weight loss, nausea, and early fullness. Advanced ulcers bleed. Watch for coffee ground vomit or black, tarry stools. These are medical red flags. Sudden, sharp generalized abdominal pain? That could indicate a perforation, a medical emergency. How ulcers are diagnosed. Diagnosis begins with your history, including NSAID use or steroid intake. Endoscopy, EGD, is the gold standard, camera in, ulcer visualized, and biopsies taken to check for H. pylori or cancer. Non-invasive testing. Urease breath test, stool antigen, or blood antibody tests detect H. pylori, but won't reveal the ulcer. Barium X-rays can show large ulcers but are much less sensitive than endoscopy. Friends, if you are with me still, now comment, I subscribed and interested. Treatment and medical options. H. pylori present. Combo of antibiotics plus proton pump inhibitors, e.g., omeprazole, lansoprazole, for several weeks. No H. pylori. Acid suppression remains key. PPIs are preferred. H2 blockers like ranitidine are still used. Antacids and sucralfate may soothe symptoms and protect ulcers. Stop NSAIDs if possible, under physician guidance. Alternative pain management or protective meds may be needed. Surgery is rare but required in emergencies, perforation, persistent bleeding, or obstruction. During endoscopy, bleeding ulcers can sometimes be cauterized, avoiding invasive surgery. Ulcers aren't minor, they're open wounds. Ignoring burning pain, weight loss, or dark stool could be deadly. Recognize the signs early. Don't assume it's just heartburn. Get diagnosed, get treated, before you face a serious complication. Ulcers kill quietly, but not if you act fast.